Yet as men cross the threshold of 60, this profound truth takes on an even more urgent, personal resonance. It's a stage of life where the foundations of long-term well-being are either fortified or sadly allowed to erode, often due to a lack of awareness or the insidious whisper of procrastination when it comes to essential health screenings. Many men, perhaps due to a lifelong habit of prioritizing work, family, or other responsibilities, tend to put their own health on the back burner, viewing doctor visits as something to be endured only when symptoms become undeniably urgent. The irony, of course, is that many of the most significant health threats at this age, cardiovascular disease, various cancers, and metabolic disorders, are often silent in their early, most treatable stages. Imagine a ship sailing into uncertain waters without a proper navigation system. That's akin to navigating the seas of aging without the crucial data that regular screenings provide. It's not about fearing what might be found, but rather embracing the power of knowledge, the confidence that comes from proactive care, and the profound freedom of knowing you're doing everything you can to maintain your vitality and independence. The alternative is a gamble many don't realize they're taking until it's too late, and the stakes are simply too high to leave to chance. Before we dive deep into the essential screenings every man over 60 needs, if you're looking for a community dedicated to embracing every stage of life with wisdom, joy, and practical strategies, make sure to hit that subscribe button right now on Aging Gracefully 60. We're here to guide you through the journey of aging, not just gracefully, but powerfully. One of the most pervasive and often silently progressing challenges many men over 60 face is the escalating risk of cardiovascular disease. It's a reality that touches countless lives, often without immediate, dramatic symptoms, making it particularly insidious. Many men experience a sense of robust health, perhaps recalling a time when their bodies seemed invincible, and therefore they might dismiss subtle changes or even outright ignore the growing evidence of cardiovascular strain. The pain point here isn't just the disease itself, but the lack of awareness until a significant event, such as a heart attack or stroke, forces the issue into stark, undeniable focus. The underlying issues often stem from decades of lifestyle choices. Diets high in saturated fats, insufficient physical activity, persistent stress, and the gradual accumulation of plaque within arterial walls, a process that begins far earlier in life but accelerates with age. The feeling can be one of false security, a quiet confidence that their heart is strong, until suddenly it isn't. The impact of this oversight can be devastating, leading to chronic conditions that severely diminish quality of life, necessitate significant medical interventions, and in the most tragic cases, result in premature mortality. It's a heavy burden to carry, both for the individual and their loved ones, and it's a situation that often leaves people wondering, why didn't I know sooner? Why didn't I take action? Doesn't that resonate with you? That feeling of wishing for more foresight? The comprehensive, actionable solution to mitigating this pervasive loneliness and the escalating risk of cardiovascular disease often lies in a multi-pronged approach that begins with proactive and consistent cardiovascular screenings. The most fundamental step is regular monitoring of blood pressure, cholesterol levels, including LDL, HDL, and triglycerides, and blood glucose. These are not merely numbers. They are crucial indicators that collectively paint a detailed picture of your cardiovascular health, signaling potential problems long before symptoms manifest. High blood pressure, often called the silent killer, rarely presents with noticeable symptoms until it's dangerously elevated, leading to arterial damage. Similarly, high cholesterol, particularly elevated LDL, contributes directly to atherosclerosis, the hardening and narrowing of arteries. Regular screenings, typically annually, allow your doctor to track these markers over time, identifying trends and initiating interventions, whether through lifestyle modifications or medication, at an early stage. Beyond these basic tests, an electrocardiogram, ECG, or EKG is often recommended, especially if there are risk factors or symptoms, to check for electrical activity of the heart and identify any abnormalities. For those with a family history of heart disease or other significant risk factors, more advanced screenings such as a stress test, which monitors heart function during physical exertion, or even a coronary artery calcium, CAC, scan, which can detect calcium deposits in the arteries, might be considered. These scans provide a deeper insight into the extent of arterial plaque. Think about how this might apply to your own life. Imagine the difference early detection could make. Furthermore, lifestyle adjustments are paramount. Adopting a heart-healthy diet rich in fruits, vegetables, and whole grains, engaging in regular moderate-intensity exercise, maintaining a healthy weight, managing stress effectively, and, crucially, quitting smoking. These strategies, when combined with consistent medical oversight, create a powerful defense against cardiovascular disease, empowering you to navigate aging with a stronger, healthier heart. Another significant and often anxiety-inducing health concern for men over 60 is prostate cancer. The pain point isn't just the potential diagnosis itself, but the confusion and sometimes contradictory information surrounding screening. Many men feel caught between the desire for early detection and the fear of unnecessary biopsies or treatments. The prostate gland, a small organ located beneath the bladder, plays a vital role in the male reproductive system, but it's also highly susceptible to cancerous changes as men age. The problem is that in its early stages, prostate cancer often presents no symptoms or symptoms that are easily mistaken for benign prostatic hyperplasia, BPH, a common non-cancerous enlargement of the prostate. This ambiguity can lead to a false sense of security or, conversely, a heightened sense of worry without clear guidance. The underlying issues often involve the gradual, uncontrolled growth of cells within the prostate, which, if left unchecked, can metastasize to other parts of the body. The feeling can be one of vulnerability, an awareness that a serious threat might be lurking beneath the surface without any outward signs. The impact of neglecting these screenings can be profound. A delayed diagnosis might mean the cancer has progressed to a more advanced, less treatable stage, leading to more aggressive therapies, significant side effects, and a reduced prognosis. It's a reality many men face, grappling with the fear of the unknown and the potential consequences of inaction. Perhaps you felt this too, that subtle apprehension about what might be discovered. The comprehensive, actionable solution to addressing the elusive threat of prostate cancer involves a balanced and informed approach to screening, centered around a discussion with your healthcare provider. The primary screening tools are the prostate-specific antigen, PSA, blood test, and a digital rectal exam, DRE. The PSA test measures the level of PSA in the blood, a protein produced by prostate cells. While an elevated PSA can indicate prostate cancer, it can also be raised by other conditions like BPH or infection, which is why it's crucial to interpret the results in context and in conjunction with other clinical findings. The DRE, performed by a doctor, allows them to feel the prostate for any abnormalities in size, shape, or texture. While neither test is definitive on its own, together they provide valuable insights. The key is not just to undergo these tests, but to engage in an open and honest conversation with your doctor about your individual risk factors, including family history, ethnicity, and overall health. This personalized discussion should guide the frequency and necessity of screening. For many men over 60, annual PSA and DRE screenings are recommended. If initial screenings raise concerns, further diagnostic steps might include repeat PSA tests, a prostate MRI, or, if warranted, a prostate biopsy. The decision to pursue a biopsy or treatment is always a shared one, weighing the potential benefits of early detection against the risks and side effects of intervention. It's a simple truth, isn't it, that informed decisions are the best decisions? Moreover, certain lifestyle factors can play a role in prostate health, such as a diet rich in fruits, vegetables, and healthy fats, and regular physical activity. While these don't prevent prostate cancer, they contribute to overall well-being. By being proactive and engaging in a collaborative decision-making process with your doctor, men can navigate the complexities of prostate cancer screening with greater clarity and confidence, ensuring they are taking appropriate steps for their long-term health. The stealthy progression of colorectal cancer represents another significant pain point for men over 60. Unlike some other cancers, colorectal cancer often develops slowly over many years, from precancerous polyps in the colon or rectum. The core problem is that these polyps and even early-stage cancers typically cause no symptoms, leaving individuals unaware of their presence. This lack of overt signs can lead to a dangerous complacency, where men may postpone or avoid screening because they feel fine. The feeling can be one of ignorance being bliss, a reluctance to look for trouble when none seems apparent. However, by the time symptoms like changes in bowel habits, rectal bleeding, abdominal pain, or unexplained weight loss manifest, the cancer may have already advanced to a more difficult-to-treat stage. The underlying issue is the silent growth of these abnormal cells, which, if not detected and removed, can develop into invasive cancer and spread to other organs. The impact of this delay is severe. Advanced colorectal cancer often requires more aggressive treatments, including extensive surgery, chemotherapy, and radiation, with a significantly reduced chance of complete cure. It's a reality many of us face, that the things we can't see are often the most dangerous, and waiting until symptoms appear is a gamble with incredibly high stakes. Think about how much simpler early intervention can be compared to tackling a widespread problem. The comprehensive, actionable solution to addressing the stealthy progression of colorectal cancer is consistent and appropriate screening, which can detect precancerous polyps or early-stage cancers when they are most treatable. The gold standard for screening is the colonoscopy, a procedure that allows a gastroenterologist to directly visualize the entire colon and rectum using a flexible, lighted tube with a camera. During a colonoscopy, any polyps found can be immediately removed, effectively preventing them from ever turning into cancer. For men over 60, a screening colonoscopy is generally recommended every 10 years, assuming no polyps are found and there are no other significant risk factors. However, there are alternative screening methods that can be discussed with your doctor, particularly for those who may be hesitant about a colonoscopy. These include stool-based tests, such as the fecal immunochemical test FIT or the GFOBT, guaiac-based fecal occult blood test, which detect microscopic amounts of blood in the stool, a potential sign of polyps or cancer. If these tests are positive, a colonoscopy would then be recommended for further investigation. Another option is a Cologuard test, which detects both blood and altered DNA in stool. For some individuals, a flexible sigmoidoscopy, which examines only the lower part of the colon, may be an option, though it is less comprehensive than a colonoscopy. Doesn't that resonate with you? The idea of having options tailored to your comfort level? The key is to discuss these options with your physician to determine the most appropriate screening strategy based on your individual risk factors and preferences. Beyond screening, maintaining a healthy lifestyle, including a diet rich in fiber, fruits, and vegetables, limiting red and processed meats, regular physical activity, and avoiding excessive alcohol consumption, can also contribute to colon health. By prioritizing these crucial screenings and lifestyle choices, men over 60 can significantly reduce their risk of developing and dying from colorectal cancer. The silent strain of diabetes and metabolic syndrome represents a growing pain point for men over 60. What makes these conditions particularly challenging is their often asymptomatic nature in the early stages, allowing them to progress unchecked and cause significant damage to various organ systems over time. Many men might feel a general malaise or fatigue attributed to just getting older, rather than recognizing these subtle signs as potential indicators of underlying metabolic dysfunction. The problem is that as insulin resistance increases and blood sugar levels gradually rise, the body cells become less efficient at absorbing glucose, leading to a cascade of negative effects. The feeling can be one of gradual decline, a creeping sense that something isn't quite right, but without a clear diagnostic pointer. This insidious progression means that by the time overt symptoms of diabetes, such as increased thirst, frequent urination, or blurred vision, appear, complications may already be setting in. The underlying issues involve a complex interplay of genetic predisposition, lifestyle factors such as poor diet, high in processed foods and refined sugars, lack of physical activity, and increasing abdominal obesity. The impact of neglecting these screenings can be devastating, leading to serious long-term complications including heart disease, stroke, kidney failure, nerve damage, vision loss, and even amputations. It's a reality many of us face, that the small, seemingly insignificant choices accumulate into large, impactful consequences. And it's far easier to prevent a problem than to treat its advanced stages. Imagine the difference early intervention could make in preserving your long-term health and independence. The comprehensive, actionable solution to addressing the silent strain of diabetes and metabolic syndrome is regular and consistent screening for blood glucose levels, along with a proactive approach to managing lifestyle factors. The primary screening tool for diabetes is a fasting blood glucose test, which measures your blood sugar after an overnight fast. A level of 126 milligrams per deciliter or higher on 2 separate occasions typically indicates diabetes. Alternatively, an A1C test provides an average of your blood sugar levels over the past 2 to 3 months, offering a broader picture of glucose control. An A1C of 6.5% or higher is diagnostic of diabetes. For men over 60, especially those with risk factors such as obesity, family history of diabetes, or a sedentary lifestyle, annual screening is crucial. Beyond diagnosis, these tests are vital for monitoring the effectiveness of treatment and making necessary adjustments. Furthermore, understanding the components of metabolic syndrome, which include abdominal obesity, high triglycerides, low HDL cholesterol, high blood pressure, and elevated fasting glucose, is equally important. While there isn't one single metabolic syndrome test, your doctor will assess these individual factors during your routine physicals. Doesn't that resonate with you? The idea of a holistic view of your health rather than just isolated numbers? The strategies to combat these conditions are largely intertwined with lifestyle modifications. Adopting a balanced diet rich in whole foods, lean proteins, and healthy fats, limiting processed foods and sugary drinks, engaging in at least 150 minutes of moderate-intensity aerobic exercise per week, and maintaining a healthy weight. Weight management is particularly effective, as even a modest weight loss can significantly improve insulin sensitivity. It's a simple truth, isn't it, that our bodies respond remarkably well to consistent, positive habits? By prioritizing these screenings and embracing sustainable lifestyle changes, men over 60 can significantly reduce their risk of developing or progressing diabetes and metabolic syndrome, thereby protecting their long-term health and vitality. The often overlooked threat of osteoporosis presents a significant pain point for men over 60, challenging the common misconception that it's solely a woman's disease. Many men, perhaps influenced by this societal narrative, fail to recognize their own vulnerability, assuming their bones are dense and strong simply because they are male. The problem is that, like many age-related conditions, bone density loss in men can be a silent process, progressing without symptoms until a fracture occurs. This insidious thinning of the bones can leave men feeling a false sense of security, unaware that their skeletal framework is becoming increasingly fragile. The underlying issues often involve a gradual decline in bone mineral density, influenced by factors such as lower testosterone levels, inadequate intake of calcium and vitamin D, lack of weight-bearing exercise, and certain medications or chronic conditions. The feeling can be one of sudden shock and profound limitation once a fracture, often from a seemingly minor fall, finally reveals the extent of the bone loss. The impact of such a fracture can be devastating, leading to chronic pain, loss of mobility and independence, prolonged recovery times, and even an increased risk of mortality. It's a reality many men face, a rude awakening that their physical resilience is not what they once believed, and the consequences can fundamentally alter their quality of life. Think about how this might apply to your own life. Imagine the impact of a hip fracture, for example, on your ability to live independently. The comprehensive, actionable solution to addressing the often overlooked threat of osteoporosis in men over 60 involves proactive screening and consistent bone health management. The primary screening tool is a bone mineral density (BMD) test, most commonly a dual-energy X-ray absorptiometry (DXA or DEXA) scan. This non-invasive scan measures bone density, typically at the hip and spine, and provides a T-score, which compares your bone density to that of a healthy young adult. A T-score of -2.5 or lower indicates osteoporosis, while scores between -1.0 and -2.5 indicate osteopenia, low bone mass. While routine screening for all men over 60 is not as universally recommended as for women, men with significant risk factors, such as a history of fractures from minor trauma, long-term corticosteroid use, low testosterone levels, chronic kidney or liver disease, malabsorption disorders, or a strong family history of osteoporosis, should discuss the need for a DXA scan with their doctor. Doesn't that resonate with you? The importance of tailoring medical advice to your personal circumstances? Beyond screening, the solutions are largely preventive and involve consistent lifestyle modifications. Ensuring an adequate intake of calcium and vitamin D is paramount. This can be achieved through diet, dairy products, leafy greens, fortified foods, and, if necessary, supplements. Engaging in regular weight-bearing and muscle-strengthening exercises, such as walking, jogging, lifting weights, or even dancing, is crucial, as these activities stimulate bone formation. Limiting alcohol consumption and avoiding smoking are also vital, as both can negatively impact bone health. It's a simple truth, isn't it, that our bones, like our muscles, need to be worked to stay strong? By combining targeted screening for those at risk with consistent adherence to bone-strengthening lifestyle practices, men over 60 can significantly reduce their risk of osteoporosis and protect their skeletal health, thereby preserving their mobility and independence for years to come. The growing concern of skin cancer, particularly melanoma, represents a significant and often underestimated pain point for men over 60. Many men, having spent decades working outdoors, engaging in hobbies like fishing or golf, or simply neglecting sun protection in their younger years, carry a substantial burden of cumulative sun exposure. The problem is that skin cancer, while often visible, can be insidious in its presentation, with early signs sometimes resembling harmless moles or age spots. This can lead to a dangerous delay in seeking medical attention, as men might dismiss new growths or changes in existing lesions as benign. The feeling can be one of "it's probably nothing," a reluctance to bother a doctor for what seems like a minor skin anomaly. However, unlike some other cancers, melanoma, the deadliest form of skin cancer, can spread rapidly if not detected and treated early. The underlying issues involve uncontrolled cell growth in the skin, often triggered by damage to DNA from ultraviolet UV radiation. The impact of neglecting these screenings can be dire. A delayed diagnosis of melanoma can lead to extensive surgical removal, chemotherapy, radiation, or immunotherapy, with a significantly reduced chance of complete cure once it has metastasized. It's a reality many men face, grappling with the regret of past sun exposure and the fear of what a seemingly innocuous spot might portend. Perhaps you felt this too, that nagging suspicion about a mark on your skin that just doesn't look quite right. The comprehensive, actionable solution to addressing the growing concern of skin cancer, particularly melanoma, involves a two-pronged approach: regular self-examinations and professional dermatological screenings. The most fundamental step is to become familiar with your own skin and conduct monthly self-checks, paying close attention to any new moles, spots, or changes in existing lesions. The ABCD rule is a helpful guide for identifying suspicious moles. Asymmetry: one half doesn't match the other. Border irregularity: edges are ragged, notched, or blurred. Color variation: the color is not uniform and may include shades of black, brown, and tan, and sometimes red, white, or blue. Diameter: melanomas are usually greater than 6 millimeters, though they can be smaller. And evolving: the mole is changing in size, shape, color, or elevation, or any new symptom like bleeding, itching, or crusting. Think about how much simpler early detection can be when you know what to look for. Beyond self-examinations, regular professional skin screenings by a dermatologist are crucial, especially for men over 60 with a history of significant sun exposure, multiple moles, or a family history of skin cancer. A dermatologist can identify suspicious lesions that you might miss, particularly in hard-to-see areas like the scalp, back, or bottoms of the feet. For many men in this age group, an annual full-body skin exam is highly recommended. Doesn't that resonate with you? The peace of mind that comes from a professional eye? Furthermore, proactive sun protection is paramount. Consistently applying broad-spectrum sunscreen with an SPF of 30 or higher, wearing protective clothing, long sleeves, wide-brimmed hats, seeking shade during peak sun hours, 10 a.m. to 4 p.m., and avoiding tanning beds. It's a simple truth, isn't it? That prevention is always better than cure? By combining vigilant self-monitoring with professional medical oversight and consistent sun-protective behaviors, men over 60 can significantly reduce their risk of skin cancer and ensure that any suspicious lesions are identified and treated at the earliest, most curable stage. As we've explored today, prioritizing essential screenings isn't just about managing potential health problems. It's about embracing a proactive mindset, cultivating resilience, and truly living life to its fullest. By understanding the common pitfalls of delayed detection and proactively applying these screening and lifestyle solutions, we empower ourselves to navigate the later stages of life with confidence, vitality, and profound joy. The journey of aging is continuous, filled with opportunities for growth and for fortifying our well-being. It's about taking agency over our health narrative, turning potential challenges into opportunities for informed action. If this discussion resonated with you, and you're ready to embrace aging as an adventure rather than an endpoint, then please take a moment to subscribe to Aging Gracefully 60. Your support helps us continue creating valuable content designed specifically for you. Hit that like button if you found this video helpful, and share it with anyone you know who could benefit from these insights. And as always, remember to leave your thoughts and experiences in the comments below. Your perspective enriches our entire community. Together, we can redefine what it means to age gracefully.